Hello, hi everyone, this is Faith. Welcome. I'm here today. Anyone there? Join me today. I'm going to talk about acetaminophen versus ibuprofen. I work in an urgent care setting. So this is a situation where I come across a lot, and usually I have to tell patient which one to take this versus that. So depending on what's going on. So please join me, say hi if you're there. Today's topic is acetaminophen versus ibuprofen. My name is Faith, and once again, I welcome all new members to Howie. And I'm going to talk about acetaminophen versus ibuprofen. I hope I'm loud and clear. If you have any trouble hearing me, please let me know. I'm going to try to make it short and quick so that anyone who hasn't watched, it doesn't seem too long and they don't have trouble watching. So invite your friends. Let's get started. Say hi if you're there. Let me know where you're watching from. Hello. Hi, Dr. Ngugi. Welcome. Hello, guys. Invite your friends. Over the past few days, I've been posting on Howie Wall about ibuprofen versus acetaminophen. And I just wanted us to get started on that discussion so that when I come and talk about it, we kind of already have an idea what's going on. So please join me, invite your friends, and let's talk about this subject. I'm going to try to make it quick so we can get back to our normal life. Hi, Marcy Craig. How are you? So thanks, guys, for joining me. Invite your friends. Let's talk about acetaminophen versus ibuprofen. My name is Faith once more, and I will try to make this as quick as possible. So let's get started. First of all, for those who don't remember the post that was on the wall, please list for me some of the acetaminophen that you know of so we can get this discussion started. There's usually some differences between acetaminophen and ibuprofen, and I'm here to just make quick references and give you quick tips and quick ideas of which one to use versus the other one. Hi, Maggie. How are you? Thank you so much. I really appreciate that. Thank you so much, and welcome. Please invite your friends. I'm going to talk about acetaminophen and ibuprofen, so please, for those who did not see the post on the wall, please list some of the acetaminophen that you know. Here in the United States, we have Tylenol, but there are different medications all over the world, brand names. The brand name we have here is Tylenol, but as we know, there are different brand names all over the world. So tell me where you're watching from, the name you use for acetaminophen, and then let's get started. By the way, acetaminophen and paracetamol are the same. They are the same medication. In Kenya, mostly you'll hear the word paracetamol, but when you come to the United States and some parts of the world, they use the word acetaminophen. So let me know where you're watching from. There's no differences between the two. So let's get started. What are some of the acetaminophen that you know of? These medications are available over the counter. And so before we can go and buy them, we have to know some information about them. So when you go to buy one versus the other, you know which one to choose. And that's why this topic is interesting, because these are medications that are available over the counter, and we all use them in one way or the other. So hi, Kimberly. Hi, everyone. Let's get started, please. Please name some medications here so we can keep it going, okay? Let's name some medications. I want this to be interactive as well as informative. So we are here to learn from each other. Like I said, in the United States, we have Tylenol. Those are acetaminophen that we have. What are other brand names that you know of in other parts of the country, other parts of the world? please let us know. We named some of them on Howie wall. You can always go back and check so you know which one is which. Acetaminophen is the common name, but we also have brand names. So people use brand names a lot, but always also know the common name. So when you don't see the brand, if you're in a different country, you don't see the brand, you know what to look for. So yes, Panadol in Kenya. Panadol is very common, and we use it a lot for a lot of symptoms related to pain. So Panadol is acetaminophen. Thank you, Master Craig. Thank you. So, okay, so what about the ibuprofen? Here in the United States, we have Motrin, and Aleve is also ibuprofen. So what other names do you know of for the ibuprofens? Name them, and if you can name them, that's good, so we can keep this discussion going. So first of all, welcome again to this live video. Thank you all for joining me. I'm going to try to make it quick so we can get back to our normal routine. First of all, acetaminophen and ibuprofen. What is the differences? Like I said, acetaminophen by itself, it's a pain reliever and fever reducer, while ibuprofen is non-steroidal anti-inflammatory medication, which means if you have a pain related to any type of inflammation, swelling, disease, that will be the medication to go for, the ibuprofen. But if you have pain, let's say you have headache, arthritis, the medication to go for in that case will be acetaminophen. So you have to know which one to go for. So if you have a headache, Aleve, the brand is the Aleve. Aleve is the ibuprofen brand. But if you have pain, let's say you have headache, acetaminophen is the brand to go for. So other things that you can use acetaminophen for is backache. Any type of pain like that, you can use the acetaminophen. But if you say, let's say you have muscle cramps, you have soreness, earache, all those kind of pain, then by all means use ibuprofen. So anything inflammation going on in your body, use ibuprofen. But if you have headache, you see the medications, especially for headaches, make sure they have the acetaminophen in it. It's better for that kind of pain. So thank you guys for joining me. Ajof, I see you. Thank you. Edward, thank you guys. So I'm here to talk about the two medications. Which one do you go for? They are available over the counter. And when you are going to buy them, first of all, anything that is serious, make sure you go see your healthcare provider. And I'm just providing general information. But for those minor aches and pains, that, you know, I have a headache, I usually have migraine headaches, then you know what to get. That is a type of headache that you've had before, no changes, no visual changes. By all means, go and get acetaminophen. That will be the best medication for you. Okay? So in terms of like toxicity, so we have to look at medication. Which one is good for you? Which one is not good for you? Hi, Monique. Good to see you. By the way, thanks for joining me, and do get involved in the discussion so we can talk and make it more interactive, so it's not just me talking. So if you are taking acetaminophen, you are taking the Tylenols, what should you watch out for? If you have liver disease, that is probably not the best medication for you. You should try to avoid medications that have acetaminophen if you have liver disease. Now, if you have kidney disease, on the other hand, you should avoid medications that have ibuprofen. The reason is they go through those organ systems to get outside the body. So there's different ways. Medication goes through Some medication go through the liver, some medication go through the kidney. So for the acetaminophen, they go through the liver, while for the ibuprofen, they go through the kidney. So these medications are totally different. So if you have liver disease, avoid acetaminophen. If you have kidney disease, avoid ibuprofen. A good thing that I always tell my patients, another thing also to avoid, elderly patients, people who have stomach bleeding, GI bleeding, any type of bleeding, avoid ibuprofen because it will make the problem worse. So if you have any type of GI bleeding, stomach bleeding, elderly patients, also high blood pressure. If you have high blood pressure, I always advise my patients not to take ibuprofen. I always advise them to take Tylenol instead, because those can get worse with ibuprofen. So for stomach issues, GI issues, by all means avoid ibuprofens. The Motrins, their leaves, avoid those ones. Another thing to look out for is, again, if you have any type of pain, let's say allergy, cold, and all that stuff, you can take the acetaminophen. So know which one to take, which one to avoid. And when you are taking over-the-counter medication, always follow the labels and look at the labels, how many you are supposed to take. Do not take more than the recommended dosage. Absolutely, Masecreg, absolutely. Thank you for that point. If you are pregnant, avoid ibuprofen by all means. So, like I said, look at the dosage. Do not exceed the dosage because, like I said, you can cause either liver or kidney damage. Avoid taking more than the recommended medication if you have pain that you feel like you have to take medication more than you should. Maybe it's time to go and discuss other forms of pain management, other forms of interventions, but do not take more than the recommended dosage. For Tylenol, for example, you take 500 milligrams over the counter every 8 hours. Do not go more than about 4 grams, but that's too much. You should never take more than 3 a day. So if you have to take anything more than that, it's time to go back to your healthcare provider and discuss other options of how to avoid, how to reduce your pain. Again, with the ibuprofen, the same thing. Usually, I never give my patients more than 600 milligrams when they come to the urgent care, because I listen to these healthcare providers in the urgent care system, and they said 600 works just as well as 800 milligrams. So 600 milligrams of ibuprofen is enough for you to, for the pain that you are going through. If you have to take anything more than that, you have to take anything more than 600 to 800 milligrams every 8 hours, then please go back to your healthcare provider and discuss other options for pain relief. Okay, guys, thanks for joining me. Invite your friends. Hi, Monari. How are you? Good to see you. Thanks, guys. I'm here talking about acetaminophen versus ibuprofen. If you are joining me, you feel free to name some of the ibuprofens and acetaminophen that you know. And like I said earlier in the video, acetaminophen and paracetamol are the same. They are the same. There's no differences between them. In the United States, we use the word acetaminophen, but in places like Kenya and other parts of the country, they use the word paracetamol. Okay? All right. Thanks, guys. Owingo, thanks for joining me. I'm here talking about ibuprofen and acetaminophen. Okay? So, like I said, watch out the dosage. Watch out for the side effects. If you have pain, know what kind of pain it is and what medication to go for. Is there any of those that has penicillin in it? No, Wairimu, they do not have penicillin because penicillin is an antibiotic and they will not put it in a medication for that you can find over the counter. So I'm talking about medications here that you can always go and find over the counter. And I'm talking about safe dosages to take. And I'm also talking about what side effects to watch out for. and I'm also talking about when you should not take it. But penicillin by itself will not be a combination of in a combination of those medications, because one requires a prescription, one can be taken over the counter. And just because you need penicillin might not mean you need Tylenol or ibuprofen. And you may need Tylenol and ibuprofen, but you don't need penicillin. So those are not in combination. They're not usually found in combination. If there's any combination out there, by all means, let me know. Another thing I wanted to talk about is as far as what did I want to say? Yeah, Tylenol and ibuprofen. Again, these medications, they go through two different systems. One goes through the liver, one goes through the kidney. So I always tell patients, especially if you have a type of pain, you can alternate between the two. You can take Tylenol and then 6 or 8 hours later you take ibuprofen. It's safe to do that. It is also safe to take those two medications at once. It is very much safe to do so because they go through a different way to get eliminated outside the body. That's the quickest way I can explain for someone who has no medical knowledge to understand. They go through two different systems. Like I said, acetaminophen goes through the liver and the ibuprofen goes through the kidney to get eliminated outside the body. So it is safe to take Tylenol and ibuprofen at the same time. The only thing is that you have to make sure you are taking the correct dosage. Now, if you are not sure, you are saying, oh, I'm not sure that I can take both of them at the same time, then by all means alternate. Take Tylenol, then 6-8 hours later take ibuprofen. So for those fevers that you're not sure of and you have to be on the clock with your medication, do the alternating. That is safe and it's okay to do that. So Irene is asking, what about Aleve? Aleve is in the ibuprofen category. It's naproxen. So Aleve is again, will be used for if you have cramps, if you have any type of inflammation, osteoarthritis, more so rheumatoid arthritis, any type of inflammation in the body, it will be safe to take Aleve. It's an ibuprofen, non-steroidal anti-inflammatory. So that's a different medication. Acetaminophen, yes, absolutely. That's what I mentioned earlier, that it will damage your liver if you take more than the recommended dosage. And I always tell my patients, you should never take more than 500 milligrams of Panadol or any type of Tylenol. You should never take more than that. Just take 500 milligrams if you have any kind of pain, and then watch out for any symptoms. And then you can take another 500 milligrams after 8 hours. So that's safe to do. So 500 milligrams, 8 hours, take another 500 milligrams. But don't go more than the recommended dosage. Take about 3 if you have to, 3 a day, but never go more than that, because then you are really putting your liver at risk. And another thing, so actually that brings me to another point. If you have, if you're taking alcohol, avoid taking acetaminophen when you are taking alcohol, because then all these medications are going through your liver. You are taking medications for TB that could be damaging to your liver. You should watch out for the Tylenols and the acetaminophen and the paracetamols if you're going to take any medication that's going to, because they go through the same organ system to get eliminated outside the body. So watch out. If you're taking any medication, drinking alcohol, you should probably not be taking Tylenol, okay? But like I said, the one that's safe is ibuprofen. But again, if you have stomach bleeding, that's not the one for you, okay? All right. Again, any questions? I wanted to make this quick so we can go back to doing what we do. what else is there that I may have forgotten? Yeah, so again, ibuprofen before or after surgery, avoid. Okay, if you have any allergy to aspirin, Aleve, avoid that kind of medication. Okay, so any questions, guys? I wanted to make this quick. I'm pretty much done. Yeah, so if you have allergies, avoid it. Again, discuss with your doctor any medication that you are taking over the counter. The cold medication, they tend to have these medications in them. They tend to have acetaminophen, and sometimes they have mostly acetaminophen. They tend to have medication, those kind of medication in them. Read your labels. If you see that your medication, the one you are taking, the acetamin, it has acetaminophen in it, then watch how much you have taken, so that by the next time you are taking the medication, you know exactly how much you have taken. Okay. Monari is saying most people swallow high dosage ibuprofen when they have constant headache. I think there's a difference between migraines and constant headaches, which might be generated by pressure at work. Yeah, so actually the best one for headaches is acetaminophen, the Tylenol, because it's not inflammatory. So ibuprofen, you're taking it if you have any type of inflammation going on, or let's say you hit your knee and you have some pain, ibuprofen would be a good one to take. Let's say your shoulder hurts and you know, swelling or any type of pain like that, it's best to take ibuprofen. But if you have a headache, like migraine headache, Tylenol will be the one to take, acetaminophen or paracetamol. That will be the best one to take. It's best for any type of pain or fever that is not inflammatory. Okay, all right, guys, I'm pretty much done. These medications are available over the counter, so whichever country you are in, if you are having sinus, headache, backache, sore throat, toothache, those are inflammatory processes. Again, go and get the ibuprofens. Okay, but I think I'm having issues with my connection. Anyway, I'm pretty much done. So if you have any questions or additions, feel free to put them in the comments and I'll be able to go back and read them. Yeah, so again, watch out for any side effects. Do not exceed the dosage. The takeaway is which one do you take versus the other. Depends on what kind of pain you have. Read the labels. Do not go above the recommended dosage. Tylenol and ibuprofen are safe to take together. Tylenol and ibuprofen can be taken alternating. You can take one and then take the other one after a couple of hours, maybe 6 to 8 hours. And side effects, if you have liver disease, avoid Tylenol and all the brand that have acetaminophen in it. And if you have kidney disease, then avoid the ones that have ibuprofen in it. So that's the takeaway from this. I hope you learned something, and I wanted to make this short and quick, and thanks for joining me. If you have any questions, I'll go back and read the comments, and we'll learn together and grow together. Thank you, guys. I'll see you next time. Have a great day. Have a great weekend. Bye.